Do you take the birth control pill? If so, for how long? Do you have side effects? I know it's difficult when you don't want to get pregnant and you feel that your only solution is to go on the birth control pill, but there are other solutions, and I want to talk to you about a few things that I've been noticing. I've been in practice for a long time, and I've seen some interesting transitions in women's hormones. First of all, let's talk about the side effects of a birth control pill. There's certainly an increased risk of blood clot. There's an increased risk of cancer, heart disease, stroke, headaches, fatigue, decreased libido, gallbladder disease, breast tenderness, what am I missing? Mood swings, decreasing your fertility after you're off the birth control pill. So if you eventually do want to have children, it can certainly be very frustrating and upsetting when your cycle doesn't then normalize after you've been on the pill for a while. So the risks are there. You can certainly look those up. I've listed a few of them. But I've noticed some other very interesting things, and that is that when I was in my 20s and early on in my practice, really up until about 7 years ago, women younger in their 20s, early 30s had very robust levels of estrogen, which they should. And really the problem we ran into was not enough progesterone, because progesterone is a hormone that when a woman's under stress can be rerouted away from making the progesterone into making stress hormones. And if a woman had normal estrogen and depleted progesterone, she would have symptoms like PMS and migraines, mood swings, anxiety, etc. So that was the common sort of picture that we saw when we checked women's blood. And by the way, it is not true that you can't detect what your hormones are doing on a blood test. You can, you just have to know the proper timing. So that's one thing I hear a lot from my patients, like, oh, my doctor says you can't, you just don't know what the hormones are doing. You can certainly know what the hormones are doing. There's just a right time in the cycle to check it. Okay, so getting back to young women. What we're finding these days, and as I said, the last maybe 5-7 years, I've really noticed a progression with this, is that we're checking young women's hormonal levels, and they're low in estrogen. So it used to be just progesterone, now they're low in estrogen as well. And I tried to wonder, what was going on. I checked with friends of mine around the country who really specialize in hormones. They're noticing it too. So not only decreased libido, young women in their 20s have no libido. This is not right. And young men to a degree as well. We'll talk about that in a minute. So decreased libido, increased incidence of PCOS, polycystic ovarian syndrome, more acne, more anxiety, headaches, etc., irregular cycles. So the hormones being extremely imbalanced. And of course, being on synthetic hormones in the form of the birth control pill, which now women are being put on very, very young because they have heavy cramping, they have issues with their cycle, either it's irregular or a lot of painful cramps, headaches, etc. They're immediately put on the birth control pill, some at the age of 15, and just left on it. That's certainly not getting to the root cause of the problem. In fact, it's exacerbating the problem. So in addition to the birth control pill, what we think is happening is that they're called exogenous estrogens. So endogenous means your body's producing them itself. Exogenous means it's coming from the outside, so it's coming in from the environment. So these are chemicals in our environment that are in a lot of products that we utilize that mimic estrogens. So there's a lot of chemicals that we use in our environment that mimic estrogens, and those coming into our system then causes your body to what's called down-regulate its production of estrogen. It sees these estrogen-like compounds and says, oh, we don't need to make as much estrogen, and then the estrogen levels go down. Hopefully that makes sense. So I feel it's a combination of these chemical estrogens as well as women taking the birth control pill, which of course is another form of exogenous estrogen that is really causing this imbalance of hormones. So Yes, there's things you can do about this. You can normalize nutrition, you can reduce chemical exposure, so it's not impossible by any stretch of the imagination, but it's really important that the hormones get balanced, because I'm seeing young women, as I said, younger and younger, and I measure their hormone levels and they're diminished. Young men, what we're finding is that they have diminished testosterone and decreased libido, because the estrogen-like chemicals are coming in and they're competing with the testosterone, and you're getting an imbalance. So both sexes, male and female, are being affected. So if you suffer with any of these symptoms, I definitely want you to reach out so I can help you. But I came across a product, it's actually close to 2 years ago now. This is not my product, I have nothing to do with it other than having heard about it, and the company has now been in existence for 4 years. And it's called Smart Woman's Choice, which I think was a great name. Dr. Fallon is the one that created the product, and what it is, it's completely natural. What it does is it immobilizes sperm. So it immobilizes them, but it's not a spermicide, so it's completely natural. It's basically potassium, coconut oil, and a little lavender. I know that sounds ridiculously simple, but the product has been on the market for 4 years. It's been tested on over 2,500 women with 0 pregnancy. I'm not selling it. Go to the website yourself, check it out, see what you think. But what's great is it's natural, it's not affecting your hormones, it's not affecting your spouse in any way, it's not a chemical. So I just wanted to tell you about that. But getting back to your health and hormonal balance, if you suffer from PCOS, heavy cramping, migraines with your period, PMS, anxiety, any of these imbalances, I want you to reach out so I can help you. We're very good at that here at Root Cause Medical. So give me a call for a free consultation. The telephone number is 408-733-0400, or visit the website at rootcausemedical.com. I'll talk to you soon.